Okay, so this was a requested video. Me and Angel Baby here are, he's giving kisses, are going to answer, and it is how long do you need somebody to stay with you after vaginoplasty? And first thing to know about vaginoplasty is 95% of my patients who have it have to travel in for surgery. Unfortunately, that's just the way it is here in the United States. There's not a lot of surgeons who do it, so we are very used to having folks from out of town. And usually I recommend the people stay in town sort of 7 to 9 days, if at all possible. And it is ideal if you have somebody with you during that time. If there's nobody able to come with you, you may be able to get by yourself, or you can set up to have a sitter or just somebody to assist you. But in an ideal world, you have somebody who travels down with you for surgery. By the time you get back home again, you should be pretty independent in most cases. So just to kind of run you through what to expect and how independent you're going to be after surgery. So if we're talking regular vaginoplasty, either peritoneal or penile inversion, most of our patients, like I said, will be down here. Usually they get in a day or two before surgery. I like to, if at all possible, meet folks in person, especially if they're traveling from out of state, answer any questions. And then the day of surgery itself usually takes about 4 or 5 hours, and you can expect to be in hospital usually 2 nights, sometimes 3, depending on how you're doing. So once you get home, you still have a catheter in, you still have packing in the new vagina. Now, you're up and walking around, and we definitely encourage that, but you get tired really early and you feel a little bit uncomfortable overall. If you're wearing loose, flowy skirts or pants, that's usually the best thing to wear. And it's just nice to have somebody around, because most folks will still need some of the stronger painkillers at that point, and those can make you a little bit fuzzy, basically. So it's really good if you've got somebody around to help you when it comes to food and that sort of thing. But otherwise, most patients are pretty independent when it comes to cleaning and getting around, just moving a lot slower than usual. And then in our practice, your first post-op visit once you leave the hospital is usually 7 days approximately, sometimes a little bit longer, but about 7 days after surgery, in order to get the packing out and get the catheter out of the bladder. Now, if you have somebody coming to that visit to help listen when we're teaching you about dilation, that sort of thing, awesome. Not everybody has somebody in their lives that they're going to be okay dilating in front of, and that's okay too, because we're going to give you written instructions. Myself and the nurse are going to take a long time with you, going through it, making sure you're not going to get out of the office unless you know how to use these guys. And basically everybody gets to know how to use these guys. These are the dilators. And at that first visit, we're going to be removing the catheter as well, so you're going to feel so much more comfortable with packing out, because packing is kind of like a big tampon. Nobody feels good with the packing in eventually as the little nerves wake up. So that'll come out, the catheter will come out of the bladder, and you'll feel much better after that visit, and most patients will go home if they're not from the immediate area within a day or 2 after that visit. So I hope that answers the question. Ideally, it's great to have somebody with you the first kind of 7 to 9 days. Not everybody can have that, and it is doable. In most cases, you can hire help if needs be. It's really nice to have an extra set of ears at that first post-operative visit, but again, for a lot of folks, that's definitely a luxury, and you can get away without having it, and we just give you stuff in writing, and we're available for questions. I hope this helps.